We are going red today. We begin this hour with National Wear Red Day. And we are wearing red to raise awareness of women's heart health. More than 60 million women in this country are living with some form of heart disease. It is the leading cause of death among women in the U.S., killing more than 300,000 every single year. Yet only about half of the women in the United States are even aware of the risks. CBS News Chief Medical Correspondent Dr. Jon LaPook joins us. Good morning. I think it's important to note, as you did before we started talking on air, the rates have decreased over the last 20 years, but yet and still, a lot of women are dying from heart disease. Why is that? Yeah, well, I think it's a dangerous misconception that heart disease is somehow exclusively a male disease, right? You pointed out it's the #1 killer in women. There's a reason why we're wearing red today, and that's to bring attention to this, because attention and understanding translates to save lives. Yeah. And when you think about the information that you have, we know some of the risks involved, you know, whether you're overweight, if you have diabetes. Can you talk about that, but also explain why so many women are dying of heart disease? Well, you know, the risk factors we've been all talking about, and you can't talk about them enough because intervening, as you said, has led to a decrease in mortality from heart disease. But, you know, we have to keep remembering the numbers. So what's your blood pressure? High blood pressure, diabetes, high cholesterol, obesity, inactivity. And access to care is another thing where, you know, you have to be able to actually see a doctor, right? So a clinician. Is there a certain screening women should ask for specifically or at a certain age? You know, because we talk about mammograms and knowing that after, you know, 35, 40 years old, you need to start checking. But what can I do personally to make sure that my heart is in good shape? I love that you bring that up because it's not something where you want to wait until you have symptoms and then say, okay, now I'm going to really, you know, get into it. This should be a lifelong thing. So from birth, you want to have healthy habits, right? You want to try to be the right weight. As you start to be seen by clinicians, you want to know what your numbers are. You want to make sure your blood pressure, because, you know, high blood pressure is silent very often. So you want to know those numbers. You want to make sure you're not diabetic. You want to make sure your lipids are okay. There are things you can do. And you mentioned birth. What about heart-related complications during pregnancy? What can women do? Well, pregnancy is a big stress test, right? You're right. I mean, you know, you wouldn't run a marathon and say, you know, like the day before, all right, I'm going to start training now. So you want to go in there with good health, and you know, part of that means again access to care, making sure that you know your numbers, that you're the right weight. You know, this has been a problem, and especially as you know, there's a increased mortality during pregnancy in black women, and it's a problem that's been addressed, you know, but sporadically and not well enough. And the reasons for it are multifactorial. It's social determinants of health. You know, if you don't have access to good housing and good food and access to care, and then on top of that, of course, we know there's implicit bias, and these all combine to increase mortality for black women. So, I mean, let's encourage people to take action here, right? Get involved. You can lower your risk, and one of the ways is to get active. A lot of people say, I don't have time, I don't have the money, I don't have the resources, whatever. What's a tip to get people off the couch and out there? So here's my tip. Like, people don't like to tell my patients, as you know, I do internal medicine and GI. Who wants to go to a gym? Okay, there are people who like to do that. But why don't you sort of have a hack to do exercise? So if you're commuting to work, how about commuting 10 blocks before work and then walk? If you're taking the elevator to the 22nd floor, take it 7 floors under that and walk. Okay, a little hack. So make it so that you're not saying, okay, now I have to do exercise. Exercise just part and parcel of just how you live your life. Really quickly, what should people know if they hear like fatigue, or what is a sign? Okay, so, you know, in women still, you know, most common cause of a heart attack in terms of symptom, you have chest pain and shortness of breath. However, there are some more atypical symptoms like nausea and vomiting and fatigue and maybe radiation of pain to your jaw or your back or some other area. I had a grandmother who used to walk for heart health, but would smoke a cigarette while doing so. Stop smoking! Thank you for reminding me that. No smoking. No smoking. She's no longer with us a long time ago. It's one of the big reasons for the drop is the decline in smoking and control of all these risk factors. She was enjoying her life, though. Dr. Jon LaPook, thank you very much.